Hello, everyone, and welcome to today's session, Is Home Dialysis Right for Me? Understanding your home dialysis options. My name is Mike Spigler, and I'm the Vice President of Patient Support and Education for the American Kidney Fund. I will serve as your moderator for today's session. In this session, you'll learn about the different options for home dialysis, their benefits and potential barriers to receiving at-home care. And now I'd like to introduce this session's speaker, Dr. Rachel Perlman. Dr. Perlman is a nephrologist at the University of Michigan, where she enjoys taking care of dialysis patients, especially people on home dialysis. In addition, Dr. Perlman teaches at the University of Michigan Medical School and serves as Associate Program Director for the Internal Medicine Residency Program. She has published articles on dialysis and anemia as they relate to chronic kidney disease. Thank you for being here with us today, Dr. Perlman, and I'm going to hand it over to you for our keynote presentation.
Thanks, Mike. I appreciate the introduction, and I really appreciate you and AKF inviting me to be part of Dialysis at Home this year. And I want to also thank everybody who has logged in today to learn more about home dialysis. The reality is that in-center hemodialysis is the default way to do dialysis in this country. And in order to do dialysis at home, you need to learn more about it and actively choose it. So I hope that what we talk about today is useful in learning more and making decisions about whether home dialysis is right for you. I should have said I have no financial disclosures. The things that I want to talk about this morning are, what is dialysis? What are the different types of dialysis that you can do? Some of the pros and cons between hemodialysis and peritoneal dialysis, what your options are for home dialysis, and especially some of the benefits and potential barriers of home dialysis. I'm going to start with a real quickie on what our kidneys do. Our kidneys make urine by filtering the blood and removing the excess waste products and fluid from our body. The kidney has other jobs too, including regulating blood pressure, vitamin D metabolism, and signaling the body to make red blood cells. When our kidneys aren't working, that is when dialysis comes in. And dialysis is life-sustaining artificial kidney function for people whose kidneys are either not working well enough to sustain them or whose kidneys have been removed for some reason. There are two main types of dialysis, hemodialysis and peritoneal dialysis. But the basic goal of each is to remove waste products and to remove extra fluid from your body, largely so that you don't get sick from the effect of these building up. Hemodialysis is often called hemo or HD, and peritoneal dialysis is often called PD by dialysis professionals and the patients who do it. And I'll probably use those terms interchangeably because that's what they're most often called. There are some variations within hemodialysis and peritoneal dialysis, but today I'm going to stick to the basics. With, again, highlighting that the real goal of each is to remove waste products and keep you as healthy as possible. When you do hemodialysis, your blood circulates out of your body through a dialysis machine and through a specialized filter that allows waste products to be removed, fluid to be removed, and the rest of your blood to be returned in a kind of simply put cleaned form to your body. And this happens as a continuous process, so there's only a little bit of blood circulating outside of your body at any one time. In order to do this, you need an access or a way to get the blood from your body to the dialysis machine. This is most often done, as shown in the picture on my screen, with what we call a fistula or a graft, where a surgeon makes a connection between your own artery and vein as a conduit to allow blood to be brought into the dialysis machine. This completely heals over, and needles are used to access that fistula or graft and deliver blood to the dialysis machine. Sometimes somebody doesn't have a fistula or a graft, either because they need to start dialysis urgently or because medically they are not able to get this done. And in that case, we usually put a catheter, which is kind of like a big IV, into the neck, and that has two openings or ports so that blood can be taken from the body through the dialysis machine and returned to the body. We consider the fistula or graft, which is usually in the arm but can be other places, to be absolutely the best way to do your dialysis, whether that's at home or in a dialysis center, because you get more efficient treatments and have a lower risk of infection. With peritoneal dialysis, we have the same goals in terms of cleaning the blood stream, but your blood doesn't pass through a dialysis machine. Instead, the lining of your abdomen, which is called the peritoneal membrane or the peritoneum, is used as a filter within your body to remove waste products and excess fluid from your body. And in order to do peritoneal dialysis, people have a surgical procedure where a catheter is placed into the skin, usually in their abdomen. It tunnels in the skin in your belly and then goes deeper into your abdomen. This heals over, but always sticks out of your body as a small catheter or tubing, which you can tape up against your belly wall so that it's not in the way and nobody can see it while you're dressed. And to do peritoneal dialysis, you put sterile fluid into your abdominal cavity. And while the fluid is in your body, waste products move from the very small blood vessels lining your peritoneum into the fluid in this cavity. And excess fluid moves in also. And after some period of time, a couple of hours, you drain out that fluid. And it brings with it the waste products or toxins that might build up and excess fluid that your body doesn't need. I'm going to talk a little bit about the pros and cons of hemodialysis versus peritoneal dialysis. And what I want to be clear about is that there isn't one best way to do your dialysis. And with these pros and cons, it's really thinking about which one you can make work for you and which one you can live with and still continue to enjoy your life and commit to dialysis, but hopefully not be excessively burdened by it. With hemodialysis, this is usually done 3 to 5 times per week. There's definitely a range, but that's how it's most often done, with treatments on the order of 2.5 to 5 hours. And so the goal of hemodialysis is usually to fit in very effective treatments into a relatively short period of time. And I say relatively short because I understand that if you're sitting in a dialysis chair, 3.5 hours does not feel like a short period of time. But what I want to stress is that when we have kidneys that work, even if they're not working perfectly, they're working 24/7. And so if you're doing dialysis, say 3 hours, or let's say 3 times a week for 4 hours, that's 12 hours a week of very efficient artificial kidney function. But it doesn't begin to mimic what our kidneys do naturally, working every single day. With peritoneal dialysis, this is daily therapy, so you don't get any days off, and there's a plus and a minus to that too. It also tends to be longer. I think of PD as slow and steady treatment. And so people do peritoneal dialysis for many hours every day. However, that doesn't mean you're doing nothing but your peritoneal dialysis, and I'll talk a little bit more about that. Because peritoneal dialysis is every day, it definitely tends to be more gentle. That's balanced against the typically fewer hours per week of dialysis when you're doing hemodialysis. In-center hemodialysis is widely available, and one potential benefit is you show up to a local dialysis center, you get your dialysis, and you go, and you don't have to do anything at home or over the other days of the week. One real benefit to PD, and this is very commonly done, is to use a machine called a cycler, which over the course of the night lets fresh fluid into your abdominal cavity and then drains out the fluid that, I don't want to call it dirty, but has the waste products and has the extra fluid in it that more approximates urine. And by doing this over the course of the night, it frees up your daytime to either not do PD or to do less PD. And so a lot of people take advantage of that nightly therapy. And the fluid that you generate by doing PD is either flushed down the toilet or put down a drain. It mimics urine because it has the same waste products that urine would typically have. When you do dialysis, you need blood to circulate through the dialysis machine, like I showed in the last slide. And so this means that you usually need to have needles put in your arm to bring the blood from your body to the dialysis machine. And usually people are not uncomfortable with those needles during the course of their dialysis treatment, but it requires getting stuck for each dialysis treatment. So if you hate needles, if you don't like the sight of your blood circulating through a machine, PD can be a really kind of huge improvement in terms of quality of life. When you do peritoneal dialysis, you do have a catheter or port in your abdomen. And so that means you can't take tub baths or go in hot tubs or do most kinds of swimming. So that's a potential negative. The reality is if you have a hemodialysis catheter, you can't do those things either. And it's having a foreign body that is coming out that could get infected that makes it not safe to do those things. And preventing infection is such an important part of getting good dialysis and living well on dialysis. So again, not a right way to do dialysis, but things to think about when you're deciding between hemodialysis and peritoneal dialysis. I want to shift now to options for home dialysis. Hemodialysis can be done both in dialysis centers and at home. And peritoneal dialysis is essentially always home therapy because it's daily, because it takes many hours of every day or every night. This is really done at home, unless for some reason you go into your dialysis unit for backup or for help, you'll be doing your treatment at home. Hemodialysis is the one that has the flexibility to be done either in a dialysis unit or at home. I want to talk about the benefits of home dialysis. And before I get into my list of benefits, I want to say what my patients who do home dialysis say about it. And this is similar to what I read in the medical literature. People who do home dialysis really appreciate doing home dialysis and really value doing it at home. And because, as you've already heard, home dialysis is not as common as doing dialysis in a dialysis unit, a lot of people at home want to make sure they have the opportunity to share that they're doing home dialysis and how much it's benefiting them. And this is true for hemodialysis and peritoneal dialysis, because they feel that very often as patients are preparing for dialysis or living with their kidney disease, they're not fully informed of this option. So I just want to share the fact that people who are doing it tend to really be advocates of home dialysis. One thing about doing dialysis at home is that it is usually done more frequently. So peritoneal dialysis, I said, is every day or every night. Hemodialysis in a dialysis center is usually, almost always in this country, done 3 times a week. And when people do it at home, they very often do more frequent dialysis. And this will be individualized to what you need. But by doing it at home, you have the flexibility to have more frequent treatments and the health benefits that go along with that. The first benefit is just feeling better. People tend to feel better when they have more frequent dialysis. Sometimes people have side effects or symptoms associated with dialysis, and they think, why would I want to do this more often? It's bad enough to have these cramps or feeling fatigued 3 times a week. But the reality is when people do dialysis, they tend to do dialysis at home and do it more frequently. They tend to feel better, and each treatment doesn't tend to take as much out of them. Because you're doing your dialysis more often, there isn't as much time for fluid and waste products to build up, which is part of the feeling better. It also makes dialysis easier on your heart and can be a good choice for people who either have some heart disease or are concerned and want to be proactive about being as healthy as possible for their heart. Blood pressure tends to be more stable with frequent dialysis, and there's a general sense of well-being that is often better with more frequent dialysis. There's also more independence when you're doing your own dialysis, and that independence means different things to different people. For some people, it's being more in control of your treatments. You learn how to do your treatments really well, and then there'll be a way and you like to do it just so, and you can do it exactly that way time after time. And a lot of people who do home dialysis end up feeling like, even though they're not medical professionals, they do it best, and they are the best person to be doing their dialysis. There is a lot more flexibility that goes along with doing your dialysis at home. I said that most people usually go to a dialysis unit 3 times a week. It's a little bit more rigid than that. And so most people either have a Monday, Wednesday, Friday, or a Tuesday, Thursday, Saturday schedule and an assigned time, and they're expected to be there at that time so that they can get their whole treatment in. And of course, your dialysis unit will work with you if you have an emergency and need to change your time. But it is a 3 time a week standing date where you need to be there. And there's some rigidity associated with that. Whereas if you're doing your dialysis at home and say you normally do your hemodialysis in the morning and you want to move it to the afternoon, that is no problem. It is really on your own time. So as long as you don't cut corners with your technique or cut your treatment short, you really have the ability to make it fit your needs. Similarly, with peritoneal dialysis, if you are using the cycler machine and you know you need to get up early one morning, you can go to bed early that night and start your treatment early and be finished in time for your morning activities. Or on the flip side, if you want to stay out late, and you can start your treatment late and continue it later into the next day. And that's really fine, and I think is one of the true beauties and benefits of doing your dialysis at home. There's also less travel time to the dialysis clinic. And if you're lucky and live only 15 or 20 minutes from your dialysis unit, it might not seem like that big a deal, but going back and forth 3 times a week, it can be a lot of gas. It can be hard when the weather's bad. I live in Michigan. Early in the morning before the streets are cleared, it's hard to get to dialysis. You also spend a lot less time in the dialysis clinic. And so your dialysis clinic is there for you in a variety of ways and expects to see you at least monthly and sometimes more often than that. But you're not going there 3 times a week for your treatments. People who do dialysis at home are more likely to keep working. They enjoy more flexible eating options. And when people are doing 3 times a week dialysis, they have to be aware and sometimes concerned about fluid and electrolytes like potassium building up in ways that aren't safe in between treatments. And when you're doing your dialysis more frequently or daily, there's less time in between treatments for these metabolic products and fluid to build up. It's also easier to have your treatment more individualized for you because the entire program or prescription is built around your needs and your timing, not fitting into the hours of a dialysis unit. So a lot more flexibility and hopefully a sense of feeling better for people who do dialysis. There are some potential barriers to home dialysis. And 2 things that I don't have on this list, But I think sometimes our barriers are there's regional variation in how available home dialysis is. And then insurance should not be a barrier. And if your insurance is paying for all or part of your dialysis now, it should pay equally for home dialysis, in-center dialysis, hemodialysis, or peritoneal dialysis. So that does not usually need to be part of the decision making. So the barriers that I usually talk to people about are learning to do the self-care. There's a lot of care of yourself involved with doing your dialysis at home. And learning how to do this is not trivial. I want to be really clear. You don't need to be a nurse or a doctor or an engineer to learn how to do your dialysis well and safely at home. You have to be willing to take on this important aspect of your care and learn how to do it meticulously to make it as safe as possible. For peritoneal dialysis, learning how to do it usually takes 4 to 5 days. For learning to do hemodialysis at home, because it is more complicated, it usually takes more like 4 to 6 weeks. During the time that you're training to do your dialysis, you're getting your dialysis at the same time. So training and getting dialysis is lumped together. Once you get home, there's still a lot of work involved. I think this is often compared to having a part-time job, and that's very real. In truth, even going to dialysis is like a part-time job, because by the time you drive there, have a 4-hour treatment, get your stuff together and leave, that's half a day, 3 times a week. So I don't want to trivialize the burden of self-care for whatever kind of dialysis you do. When you do dialysis at home, you have less contact with the dialysis staff, and some people feel more comfortable going into their dialysis unit 3 times a week, knowing that they'll have contact with a nurse and a dialysis technician. When you do your dialysis at home, you need a place to do your dialysis. You need to set up part of your home or part of your bedroom to have your dialysis machine. You need a place to put your dialysis supplies, and this is non-trivial. You will definitely have medical supplies in your home, and they take up space, either a big closet or a small room or part of a room. People who do dialysis at home order their own supplies. Most people do this online, sometimes on the telephone. The supplies are delivered to your home, and as part of the delivery person will not leave them on your doorstep like Amazon, but will put them exactly where you want them, and will also rotate your stock so that things aren't expiring because they're at the back row of your closet and not getting moved to the front. There's also potential need for a care partner, somebody to do your dialysis with you when you're doing it at home. Peritoneal dialysis tends to be more independent, and some people do this at home with nobody else around, absolutely confidently, with the long treatments and no blood outside of your body. It's a very stable treatment and doesn't lead to rapid changes in blood pressure or usually how people are feeling hour to hour. But very often people do need help either setting up the machine or moving the supplies from their closet to the machine. And so we love training a care partner to help both with those things and with any other troubleshooting that needs to be done at home. For hemodialysis, many dialysis clinics require you to have a partner in dialysis at home with you when you do dialysis. This is because with blood circulating outside of your body, it is more common to have changes in blood pressure or bleeding, and having another person there is reassuring and can be useful for troubleshooting and safety. The most commonly used home dialysis machine in the US is FDA approved for solo home use, meaning without a care partner, without anybody else in the house, but not all dialysis units are comfortable with this setup. And by doing your dialysis more frequently at home, if you are needing a care partner or even just help setting up your PD machine, it does mean more reliance on that person. I started to come up with some questions that I hear about troubleshooting, but Mike, I'm hoping I can invite you back into the conversation now, because I know you've been taking questions today and on this topic many times. And so I'd love to open the last part up to a discussion with you.
Yeah, absolutely. Well, Rachel, first off, thank you for the great overview. This is a perfect way to kind of start things off with our viewers getting a base of understanding what we're trying to get across here with the benefits of home dialysis and just dialysis overall. I think there is a question that we get very often, because ACAP has been championing home dialysis for such a long time. So we've heard a lot of these things. And I think, especially when you think about the amount of people that quote unquote kind of crash into dialysis, right? So there wasn't a lot of warning or any warning before they went to the emergency room. They find themselves in center, and they've got nurses and techs coming by all the time and things beeping. And how can I possibly do this at home is the question that I think we get a lot. But we really want to emphasize that you can. And how would you respond to that question like that, Rachel?
Yeah, I would really want to emphasize that you can do this. And first of all, the machines at home are simpler than the machines in the dialysis unit. They have been really built for user friendliness. They all have touchscreen technology. They have a 24-hour help desk, which is really answered by people who are not your medical experts, but who are experts in the machine. And so if you have a machine malfunction, somebody is standing by to help you with that. We teach you what to do. Training is extensive. You don't get to go home with your dialysis machine, hemo or peritoneal, until you feel comfortable using it, and your nurse or training, it's usually a nurse who does the training, feels like you can do this in a way that is capable and safe. So yes, you really can do this at home. And away from the hustle and bustle of the dialysis unit, it's only your machine that you're responding to. And I think in the dialysis unit, it seems even a little bit more chaotic, because the machine next to you starts to beep, and then the one across the room. And so I think that adds to the sense that it's a little overwhelming.
Absolutely. And I think another question we get too is, okay, well, if I'm in center dialysis and I'm traveling, my social worker will find another clinic, whatever town I'm going to, and I can do it there. I guess I can't bring my machine and go to wherever I need to go for home. But I will tell you, we do multiple fly-ins a year where we bring patients in to go up and advocate for bills on Capitol Hill here, and they are bringing their machines. So can you just give some insight into how that works?
Yeah, I absolutely can. And I think travel is really important. People want to go see family. People want to see other parts of the country or the world. And you can definitely travel with home dialysis. I'll start with PD. If you want to go somewhere that's not too far, say for the weekend, you can literally put your machine and your supplies in your car and take it with you. And that's terrific, and probably the absolute simplest expression. People have done PD in hotel rooms, in their camper vans, no problem. If you're going further, if you're flying, your machine can go on the airplane as carry-on. Your dialysis unit will give you a letter explaining it, and you can have supplies delivered where you're going to be arriving. With home hemodialysis, very similarly, either you can bring your machine with you and have supplies delivered. I had a patient go to Hawaii for a month in the winter with his home dialysis machine. So you can do your own dialysis when you travel, or if you don't want to deal with that aspect of traveling, you still have a dialysis social worker, and that person will help you find a dialysis unit close to where you're going. And so you could transition to doing your dialysis in a regular dialysis center for a week or two.
Great. Well, first off, if you could ask that patient to bring me with them the next time that they go to Hawaii for a month, that would be fantastic. So let's talk a little bit about infection. So, this is something, obviously there's a lot of infection controls that happen in center. And I think patients are going to be seeing people in scrubs and gloves and masks. And well, I'm not going to have that at home. So how does that work? So I guess two questions. One, can you kind of calm some nerves around infection? And two, if someone's doing dialysis at home, what should they be looking for as like signs of infection?
Yeah. So first of all, part of training to do dialysis, whether it's hemo or PD, is learning to do it in the absolutely safest way to protect yourself against infection, because that's something that we worry about whether you're in the dialysis unit or at home. And I work in a dialysis unit and I'm proud to do that. But I will tell you, during COVID, I felt so awful that my patients had to come in 3 times a week and sit close to each other, even with everybody wearing masks, and when we had less of an idea about transmission. And so we were as meticulous as we could be in the dialysis unit to deal with infection. And I think dialysis units are, but being in the dialysis unit with other people who might have the flu or a respiratory infection or a diarrheal illness, it's absolutely possible to get infections in your dialysis unit also. So there are some infection benefits from being at home. Your house does not need to be a sterile playing field. We do ask you to keep your supplies absolutely away from pets, to keep your dialysis away from pets. We teach you how to be meticulous with not just washing your hands, but following multiple steps to prevent infection with whichever kind of dialysis you're doing. And we also teach you what to look for if you do have an early infection, so that you can contact your team and hopefully start treatment really early.
Great. Well, I think we have time for maybe one question before we kind of do wrap up and final thoughts. Can you talk maybe a little bit about the training someone deals with, knowing that obviously sometimes if you're in a rural area, it might be different than an urban area and some slight variations, but what does it typically look like?
Yeah, so usually for training, people will come into the dialysis center to do it, and they'll work one-on-one with the nurse and learn how to do from the basics of how to take your vital signs correctly, because that's a really important part of getting safe dialysis, to using the machine. If it's hemodialysis, either you or your care partner will learn to put needles in your access. And I have many patients who do that alone successfully, depending on their dexterity and where their access is. And then I have many other patients who need a partner to help them with that because they can't manipulate the needles themselves, or frankly, they don't want to manipulate the needles themselves. But that's part of the reason that the training for hemodialysis takes longer, because we want you to be, as good as your own technician doing your dialysis treatments. So one-on-one, there's usually a spelled out curriculum that you work through. And if you need an extra day for PD, or if you need an extra week for home hemo, that's great. Your nurse will work with you until you are ready to do it at home. And excellent. I do think that home therapy is especially good for people who live in rural areas, because dialysis units can become so spread out. And I mentioned driving to a nearby dialysis unit, but in northern Michigan, you can drive an hour, and in our really large western states, a dialysis unit can be much more than an hour away.
Yeah, when you're doing it 3 times a week or more, that's a lot to ask for someone back.
That's huge.
Yeah. Well, thank you so much, Dr. Perlman. This session's really been a great way to kick off Dialysis at Home 2025. Before we close out, I'd like to ask you to maybe share one thing you'd like our audience to know and one thing you'd like our audience to do based on today's session.
Yeah, I was hoping you would ask that, because I actually talked with my multidisciplinary dialysis team. So that's adds in a dietitian, a dialysis nurse, and a dialysis social worker to make sure that I was representing the importance of the multidisciplinary team and what they thought also. And so the first thing that as a team we want you to know is that you really can do this, and you have to learn more and you have to seek it out, but don't be intimidated by what you need to learn. And it's okay to switch. If you start off on hemodialysis and you realize it's not what you expected, you can switch to peritoneal dialysis. And similarly, if you start on PD and it with all the troubleshooting that your team does with you, it's not meeting your needs, it's okay to switch to hemodialysis. And then the thing to do is really learn more. I said this at the beginning and I'll close with it. In this country, in-center hemodialysis is the default pathway, but that does not make it the best pathway for everybody. And in order to do home dialysis, whether that's hemodialysis or peritoneal dialysis, you really do need to learn more and work with your nephrologist or your dialysis team to have that information individualized for you. There are great online resources, starting with AKF and then several others. So I encourage people to keep learning about home dialysis.
Fantastic. Well, thank you again, Dr. Perlman. Thank you to all of you for joining us today. Up next is our Making the Switch, Adapting to Life with Home Dialysis session at 11:45 a.m. Eastern. During that session, you'll hear from several panelists as they discuss their experiences adjusting to home dialysis. As we wrap up this session, you will see a brief survey pop up. Please take a minute to fill it out and tell us how we did today. Your feedback will be very useful as we plan future sessions. Thank you, everyone. Have a great day.
Thanks a lot.